Hey everyone, Daniel here. Today we're going to be talking about the core. The inner core, the outer core, the who, the what, the when, the where, the why, and the how of the core. So let's get going. So on to the core. The core can be broken into two different sections, the inner and the outer core. So the outer core is actually what most people, when you talk to them about core, it's what they're thinking of. It's the obliques, it's the abs, those things that everybody wants. They look good, but then if you're not having a strong inner core unit to work with it, it can actually be almost trouble for disaster. The inner core unit, however, is specifically 4 groups of muscles. We consider them to be the pelvic floor, so that's the stuff that helps you hold your pee and your poo in. It's also your multifidus, which is a muscle that runs up your spine in the back. The third one is actually a transverse abdominis, and that one is a muscle that wraps around your waist, kind of like a weightlifter's belt. And the fourth muscle is actually your diaphragm. So breathing can actually play a big part into your core and your core activation. Well then, you might be asking, well Daniel, how do I know if I don't have good inner core activation? Well, let me tell you. The easiest way to tell really is if people are holding their breath when they do their exercises. That means they just go and pretty much that's it when they do their whole exercise. They're holding their breath, they're using their diaphragm to press down on their organs to replicate stability in their lumbar and in their back and everything. But that's not a proper inner core activation. So people like this often find that they'll have back pain during simple exercises like lunges or planks, push-ups, squats even. These things require lots of core stability, but if they can't get it, they'll breath hold or they'll find other ways to make up for it. So what can you do if your inner core isn't activating properly? Well, the best way is for you to come in and we can do a bit of an assessment, see how you're compensating for it, how you're activating different muscles to actually replicate the core activation, but not actually getting it. So with that, we can figure out some specific exercises that will help to get that muscle working well so we can actually engage it and keep you safe when you're doing other exercises. So why don't we just go right into the gym and I'll show you a few exercises, maybe 2 easy ones, 2 more difficult ones, and 1 just ridiculous one just for the fun of it, and we'll see how you do with it. But I guess I'm not wearing proper attire. Well, we can change that. Alright, perfect. I'm changed. Let's get going then. So here we have heel slides, but just to let you know, for all of the core exercise, make sure that you take nice deep breaths in and out. Don't hold your breath, otherwise that will cause you to use the wrong muscles. As you do the heel slide, bring your leg out and extend your knee and your hip. But when you do this, make sure that the curve in your lumbar it stays the same and does not change. To make it a little harder, bring both your legs up and do the same extending of the hip and the knee. Okay, up next we have the plank. For the plank, you can just hold it in that position, or you can also extend and abduct your leg just a bit. This will work the glute med muscle. Make sure that your lumbar doesn't extend too much but holds in a nice neutral position. Next up we have side plank. So from this, you hold your body nice and straight. Again, make sure that the lumbar is nice and straight. Keep your shoulders perpendicular from the ground. And if you want to add a little bit of a twist so that it's a little harder, rotate onto almost a front plank there, and then go back into the side plank. You can pivot at your feet. Next up, I'm not even sure what they call these, but all you do is you flex at the hips and bring your legs up. It's nice to hold on to some dumbbells so that your upper body does not move, but make sure that you're not extending your lower back too much. If you want to make it harder, we can make it a partner exercise. So same idea, but this time instead your partner pushes your legs in all sorts of directions. Straight is the easiest, but you can also go off to the side and you have to control the descent and bring your leg back up as quickly as possible to your partner. This can be quite a tiring exercise. And next, just for the ridiculous exercise, these are just some pull-ups and going into almost a front lever, but also rotating and going off to the sides for the obliques and not just the rectus abdominis. And this one is a workup to a front lever, which I couldn't quite do. So thanks for watching us, everyone. Hope you found that helpful. And if you did, make sure you follow us on our Instagram, on our Facebook, and on our YouTube. Of course, you're more than welcome to call in and book an appointment with us and see how we can help you with training your core. So until next time, stay safe, stay strong, stay active.